Chapter 13, Security. Data can be classified in a number of ways. One way is to classify data according to data type: clinical, administrative, financial, and so on. Data can also be classified into categories according to the level of security required. Different terms might be used, but one example is PHI, that is sensitive and public. Historically, security regulations were enacted at the state level. Because of security concerns of healthcare professionals and patients alike, federal laws were enacted. This chapter will address the Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, and security concepts such as security threats and safeguards. HIPAA is divided into 5 titles or sections. This chapter addresses Title II, Fraud and Abuse/Administrative Simplification. The purpose of the Administrative Simplification title is to improve the efficiency and effectiveness of the business processes of healthcare by standardizing the EDI, electronic data interchange, of administrative and financial transactions. This title was also designed to protect the privacy and security of PHI, or protected health information, that is transmitted from one point to another. PHI is individually identifiable health information that is transmitted or maintained in any form or format by an organization subject to HIPAA. To be subject to HIPAA, an organization must meet the definition of a covered entity, or CE. A CE is a health plan, healthcare clearinghouse, or healthcare provider that transmits any health information in electronic form for one of the covered transactions. A health plan, healthcare providers, healthcare clearinghouses collect billing data and processes it for the healthcare provider. The covered transactions that HIPAA addresses are health plan premium payments, enrollment or disenrollment in a health plan, eligibility, claims, payment and remittance advice, claims status, coordination of benefits, health claims attachment, and first report of injury. The Transaction and Code Sets rules was designed to standardize transactions performed by CEs. These standards apply to electronic transactions only. The Department of Health and Human Services, or HHS, has assigned the responsibility of developing and maintaining standards for the Transaction and Code Sets rule to 6 organizations called Designated Standard Maintenance Organizations, or DSMOs. Examples of these organizations are the Accredited Standards Committee X12, Dental Contact Committee of the American Dental Association, Health Level 7, or HL7, National Council for Prescription Drug Programs, the Uniform Billing Committee, and the National Uniform Claim Committee. Transaction and code set standards cover the individual data elements and the format of the data for claim submissions and other functions mentioned earlier in this chapter. Designated code sets are also a part of the HIPAA transaction and code set rule. HIPAA defines a code set as a set of codes used to encode data elements. HIPAA mandates the use of certain coding systems in the reporting of diagnoses, procedures, drugs, and more on medical and dental claims. These standards are the International Classification of Diseases, 10th Revision, Clinical Modification, or ICD-10-CM. The International Classification of Diseases 10th Revision Procedural Coding System, also known as the ICD-10 PCS, Current Procedural Terminology 4th Edition, also known as CPT-4, Healthcare Financing Administration Common Procedure Coding System, also known as HCPCS, Code on Dental Procedures and Nomenclature, 2nd edition, also known as CDT2, and finally, the National Drug Codes, also known as NDC. The HIPAA privacy rules controls how CEs and business associates may use PHI. Business associates are individuals or organizations that perform work on behalf of the CE and that require access to PHI. Examples of functions that business associates may perform are coding, release of information, and billing. The privacy rule also lists the following PHI-related patient rights. The patient must be provided a notice of privacy practices. The patient has a right to inspect, copy, and receive a copy of the medical record. The patient has the right to request an amendment to the health information. The patient has the right to request communications from the CE through alternative means, such as post office box rather than the home address. The patient has the right to report violations of the HIPAA privacy rule, and the patient has the right to request restrictions on how his or her PHI is utilized by the covered entity. The security rule has two definitions that focus on different aspects of security. 1. The means to control access and protect information from accidental or intentional disclosure to unauthorized persons and from unauthorized alteration, destruction, or loss. 2. The physical protection of facilities and equipment from theft, damage, or unauthorized access collectively. The policies, procedures, and safeguards designed to protect the confidentiality of the information, maintain the integrity and availability of information systems, and control access to the content of these systems. The security rule does not apply to PHI in other media such as paper, oral communication, and microfilm. The security rule was developed to be technology neutral and scalable. The American Recovery and Reinvestment Act of 2009, also known as ARRA, introduced new requirements related to security. 1, certification of EHRs. 2, mandated HIPAA audits. 3, increased severity of penalties. And 4, business associates were now subject to privacy and security regulations. Threats are the potential for a vulnerability to be exploited. Vulnerabilities are weaknesses that could be exploited, thus creating a breach of security. External threats can be caused by people outside the CE who attempt to gain unauthorized access. External threats also include natural disasters such as floods, tornadoes, and hurricanes. The goals of the HIPAA security rule are to ensure the confidentiality, integrity, and availability of the EPHI. Administrative safeguards are people-focused and include requirements such as training, policies, and the assignment of an individual responsible for the security. Physical safeguards are mechanisms in place to protect hardware, software, and data. The physical safeguards should protect EPHI from fire, flooding, unauthorized access to hardware, theft, and other hazards. Technical safeguards use technology to protect data and to control access to the data. Administrative, physical, and technical safeguards are broken down into implementation specifications and standards. Each standard is defined as required or addressable. Risk management is a comprehensive program of activities intended to minimize the potential for injuries to occur in a CE and to anticipate and respond to ensuring liabilities for those injuries that do occur. There must be processes in place to identify, evaluate, and control risk. The first step in risk management is the development of a risk management plan. Each covered entity must develop a sanctioned policy that addresses how employees will be penalized for failing to follow security policies and procedures. CEs are required to conduct an information system activity review, which monitors for the inappropriate use or disclosure of EPHI. Security rule mandates an individual to be in charge of the security program for the covered entity. HIPAA calls this individual a security official. However, this position is frequently called Chief Security Officer or CSO. The CSO is responsible for developing the security goals and objectives for the covered entity. It is responsible for determining how the goals and objectives will be met. It is responsible for advising administration regarding information security, determining reporting procedures, conducting adequate risk assessment, and determining the appropriate level of risk acceptance. Finally, it is responsible for developing and monitoring the overall security program. Information access management involves implementing policies and procedures to determine which employees have access to what information. One of the ways a healthcare clearinghouse can accomplish this is to isolate PHI from the rest of the clearinghouse's information. The workforce clearance procedure ensures that each member of the workforce's level of access is appropriate. There must be a termination process to eliminate access to the information systems by a member of the workforce when that person's employment with the CE ends, either through resignation or through termination. All workforce members must receive security awareness training. Basic training should cover general security policies, physical and workstation security, password management, the importance of logging out, and other issues. Many workforce members will require additional security training appropriate to their job functions. HIPAA does not mandate the format that the training takes, but a recommendation is to include it in new employee orientation. Face-to-face training classes should be supported with periodic security reminders. HIPAA requires that documentation of the training, including the following, must be retained for 6 years. This documentation includes sign-in sheets, handouts, email messages, and a training database identifying training and actions taken. The security rule defines a security incident as the attempted or successful unauthorized access, use, disclosure, modification, or destruction of information or interference with system operations in an information system. The ARRA requires CEs to actively identify and report security incidents. The security incident policies and procedures should identify how the incidents will be identified and to whom they should be reported. Forensics is the process used to gather intact and validated evidence and is the process that should be used to gather evidence of the security incident. Intentional destruction, mutilation, alteration, or concealment of evidence or alteration of evidence is called spoliation. Mitigation is the process of attempting to reduce or eliminate harmful effects of the breach. Security events are poor security practices that have not led to harm, whereas security incidents have resulted in harm or a significant risk of harm. Covered entities must also critique its security program through ongoing monitoring and evaluation to identify areas for improvement. The evaluation must include technical and non-technical processes. The Business Continuity Plan is a program that incorporates policies and procedures for continuing business operations during a computer system shutdown. A contingency plan is made up of policies and procedures that identify how a CE will react in the event of an information system emergency, such as power failure, natural disaster, a hacker, malware, or a system failure. To help prevent failures due to hardware failure, redundancy is needed. Redundancy is a duplication of data, hardware, cables, or other hardware components of the information system. The CE must have plans in place to get the information system working again, and then to update it with all activities that occurred during the downtime. The emergency mode operation plan encompasses procedures necessary to keep critical business processes of the covered entity in place during information system downtime. When the information systems are again functional, data recovery must occur. Data recovery is the process of recouping any data that has been lost from the information system crash, as well as the data that was obtained during the downtime. Data captured during downtime must be entered into the information system to bring it up to date. The covered entity may want to consider establishing a hot site. A hot site is a remote location that is set up with an exact duplicate of the information systems and data. Business associates are organizations that conduct business on behalf of the covered entity. These associates require access to PHI in order to do their jobs. BAs are subject to the HIPAA security rule. There must be a business associate agreement between the CE and the BA that meets the requirements established in HIPAA. The BAA, Business Associate Agreement, spells out the BA's responsibilities and how it should protect PHI. The BAA should also allow the CE to terminate the contract if the BA fails to meet the responsibilities in the Business Associate Agreement. Technical safeguards are defined by the security rule as the technology and the policy and procedures for its use that protect electronic protected health information and control access to it. Technical safeguards use technology, policies, and procedures. Access controls are a computer software program designed to prevent unauthorized use of an information resource. CEs must define in their policies and procedures who can view, create, and modify data. There are several types of authentication. In role-based authentication, the functions and data available to the user are based on the role of the user. In user-based authentication, the functions and data available are based on the needs of the individual user, not all users with the same job title. Context-based authentication controls access not only by the role that the employee has, but also by the individual data elements and the context in which the user is working. There may be times when the users need to have access to the data they are not normally allowed. This is called emergency access procedure or break the glass. User authentication methods include username, one-factor authentication, which utilizes one level of access control, such as a username and password. Two-factor authentication combines two different categories of access control, such as something you know and something you have. Passwords, something you know, are an example of one-factor authentication. Strong passwords should not be easily guessed. Passwords should be changed periodically, and reuse of previous passwords should not be allowed for at least a period of time. Policies should state that the password is confidential and cannot be shared with anyone else. One problem with passwords is that users often have too many of them to remember. Information systems throughout a CE frequently require different passwords. One way to overcome this issue is the use of single sign-on systems, which are designed so the user logs in one time. The user is then able to move from one application to another without entering another password. However, this single sign-on makes it even more important to protect the password so that the system is not at risk for unauthorized access. A token used for security is usually a physical device that an authorized user of a computer services is given to aid in authentication. Biometric identifiers are based on a physical characteristic and are used to access the secure areas such as the data center or an information system. They are categorized as something you have. Retinal scans, fingerprints, facial recognition, and voice prints are biometric identifiers. Another form of entity authentication is telephone callback, which is most commonly used when users access the information system remotely, such as from their home. One of the requirements in the HIPAA security rules technical safeguards is the automated log off, which automatically logs the user off when a workstation is inactive for a specified period of time, such as 5 minutes. The amount of time should be a balance between the need for privacy and security and the need to give the user time to review the data. Audit trails are the record of these system activities, such as log in, log out, unsuccessful logins, print, query, and other actions. User level controls record what actions the user initiated, such as resources access. Integrity is the security principle that protects data from inappropriate modification or corruption. This includes both unintentional and intentional modifications and destructions. Transmission security involves mechanisms designed to protect EPHI while the data are being transmitted between two points. Encryption is frequently used to protect data as it moves across networks. Encryption converts data from a readable form to an unintelligible text. There are two categories of encryption: symmetric and asymmetric. Symmetric encryption assigns a secret key to data. In asymmetric encryption, an extremely popular method, also known as public key infrastructure, two keys are used. The sending computer uses a private key to convert the data. The public key is provided to the computer with whom the sender is communicating. This public key converts the data into a readable format. HIPAA mandates the use of a network security method to protect the EPHI as it travels across the network. Network security uses technology to protect the data transmitted across the network, including firewalls and encryption. Another way to protect data as it is transmitting is a virtual private network, or VPN. A VPN creates a tunnel through the internet that allows data to be shared securely. Malicious software, also known as malware, is designed to harm a computer. Anti-malware and other software packages are designed to identify and stop or clean up malicious software, which includes viruses, worms, trojans, bots, spyware, phishing, and ransomware. Malware can also harm biomedical devices. A biomedical device is an article, instrument, apparatus, or machine that is used in the prevention, diagnosis, or treatment of illness or disease, or for detecting, measuring, restoring, correcting, or modifying the structure or function of the body for some health purpose. Anti-malware and other software packages are designed to identify and stop or clean up malicious software, which includes viruses, worms, trojans, bots, spyware, phishing, and ransomware. Physical safeguards are an important part of security. The security rule defines physical safeguards as physical measures, policies, and procedures to protect a CE's electronic information systems and related buildings and equipment from natural and environmental hazards and unauthorized intrusion. The CE must implement facility access controls which limit physical access to the data center and software to only authorized information system staff. Access to the data center can be controlled by card keys, access codes, or other control methods. Visitors are frequently required to sign in and be escorted while in the data center. Cameras may also be used to determine who had access to the data center or other critical areas in the event of a security incident. Physical safeguards also cover workstation use. Workstations include not only desktop computers, but also handheld devices, laptops, and other pieces of equipment that manage EPHI. Blackout screens can be used to prevent unauthorized users from seeing the content on the screen when walking by the computer or looking at it over the shoulder of the user. Policies and procedures should be in place to protect the workstations from viruses, breaches of privacy, and other practices. Media that store EPHI must have policies and procedures that control its movement and storage. With the advent of portable devices such as tablets and mobile phones, tracking media is becoming more and more difficult because the devices are moved around for use in patient care. CEs must have a policy in place to protect them from loss or destruction. Once the media is no longer needed, there should be a formal process for its disposal. Degaussing is application of a magnetic field to the media to render the data on it useless. Degaussing renders data impossible to recover and is not reversible. Mobile devices take many forms, including tablets, smartphones, and thumb drives, and are easily stolen, lost, or misplaced. Every item should have a property control tag attached so that the hardware can be tracked as it moves throughout the CE. Best practices for the use of mobile devices in a CE include defining who owns the device, defining who owns the data, not storing PHI on mobile devices, and utilizing encryption. Some CEs allow healthcare providers to access ePHI on their personal tablet or phone. This practice is known as Bring Your Own Device or BYOD. Remote wipe is used when data must be deleted from the mobile device remotely because it has been lost or stolen. Backup files should be stored on an off-site server that would not be at risk for the same disaster, such as a flood or fire. The oversight of the HIPAA security rule has been given to the Office of Inspector General, which has the right to award civil and criminal penalties. There are 3 privacy or security certifications. Certified in Healthcare Privacy and Security, or CHPS. There's Certified Information Security Manager, or CISM, and Certified Information System Security Professional, CISSP. The CHPS is designed specifically for healthcare, whereas the CISSP and CISM are general security certification.